Hello, I'm Dr. Barry Pecos, York Region's Medical Officer of Health. Last week, we waited with bated breath to hear whether the World Health Organization would declare the pandemic over or renew the emergency declaration. They very wisely maintained the emergency, noting that across the globe, including here in York Region, the pandemic is still having a very significant impact on individuals and communities and has the potential to worsen with new variants. But we are at a crossroads, a transition point. We know that the SARS-CoV-2 virus, the virus that causes COVID-19, will remain permanently established in humans and animals, but we are now starting to look towards the long-term management and to the future, particularly avoiding the pandemic and neglect cycles that we've seen globally, but fortunately not here in York Region and in Ontario. Make no mistake, COVID-19 is still a public health emergency of international concern, but we are hopeful that its impacts are becoming more manageable over time as we continue our efforts and as more people are vaccinated with the bivalent vaccine. In fact, at York Region Public Health, we are well underway planning for the transition of our COVID-19 division into our regular communicable disease division, an important step for us in moving towards a new normal. That said, here in York Region, while our wastewater signal is decreased significantly over the last few weeks, our hospitalizations are actually up somewhat, and we still have persistent, near daily death notices from COVID-19. This is unacceptable and remains a burden on our hospitals and a tragedy for each and every family who loses a loved one. The Omicron subvariant XBB 1.5 is highly transmissible and is rapidly becoming the dominant variant in our community, now representing approximately 40% of cases. Fortunately, illness and symptoms from XBB 1.5 are not more severe than other variants, and we know that the bivalent vaccine protects against XBB 1.5, which is an Omicron subvariant. It prevents severe illness, hospitalization, and needing ICU care, with new data from Ontario and in the US confirming its efficacy. New studies also confirm that it protected pregnant women from hospitalization this last year, among many other groups that have been studied around the world. With minimum pandemic control measures in place, it is extremely important for everyone to receive a bivalent vaccine. This is proven to be the best defense we have against COVID-19 and the best chance to return to a more normal state. Everyone 5 years of age and over should be receiving a bivalent vaccine, especially if you haven't had a vaccine dose or COVID-19 infection in the past 6 months. Immunity does wane over time. Walk into a York Region Public Health Clinic to get your vaccine or book ahead at york.ca/COVID-19 vaccine or call Access York at 1-877-464-9675. Along with making sure you have a bivalent vaccine, don't forget other precautions. While masks are not mandated, wearing one when you find yourself in close contact with others, particularly if those others are older or immune compromised, can protect yourself and loved ones from contracting COVID-19 or other respiratory illnesses. Make sure to wash your hands when appropriate, and it remains critically important that you not expose others if you have any symptoms. While winter is not over yet, many are looking to getting away from the cold and hopefully enjoying some travel that may have put off through the years of the pandemic. Many of us are craving relaxing time away or trips visiting friends and loved ones. This is even more of a reason to make sure that you're up to date with your vaccination before you travel. Make sure you're protected as much as you can be before heading to the airport or to a different country. With travel restrictions lifted, being vaccinated is the best defense you have against this airborne virus. So where are we today? Is COVID-19 endemic? Are we at a steady state? Not quite yet. It still has further pandemic potential and is so dramatically impacting our acute care resources, but now in a chronic way that we've become used to over the past 3 years. But if everyone continues to do their part to protect each other, get the bivalent vaccine, and mask up when needed, I'm hopeful we can look towards a healthier spring and summer and finally move beyond the pandemic.